And the latest case is that of the fallen General, Major General Paul Okech, the Deputy IGP of the Ugandan Police. But again, it was the same case in the autopsy report in the death of Dr. Cyprian Kizito, the former Archbishop for Kampala Diocese. Now, we need to understand some much more about blood clots, how they occur, and probably how we can avoid cases of blood clots in future. And to do that, we have an expert waiting, and he is Dr. Ivan Chisule. Ivan Chisule is a physician with about 7 years experience and practice in internal medicine, working with Mulago National Referral Hospital. Dr. Ivan Chisule, you are live on Soul TV, and I would want you to tell us something about blood clots, especially for a start, what causes blood clots and how do they actually occur and at last feature in autopsy reports?
Yeah, thank you very much, Mr. Apple, for hosting me to talk about blood clots. So, for starters, the blood clot forms within the blood vessel of an individual. We know that our bodies have blood vessels in all parts of the body, but actually the major blood vessel is the heart. So the heart pumps blood, and this blood moves through those channels which we call blood vessels, and then it distributes the blood to the different parts of the body, the brain, the lungs, the legs, and all other body parts. Now, blood clots, when they are to occur, the blood that is moving within the blood vessels gets a problem. So when this blood gets a problem, normally blood is in liquid form. Just like the way you see water flowing in a water channel. That's how blood moves within our blood vessels. So if there is no problem blocking the water will flow from one end to another end. So that's the same way blood moves in our bodies. When the heart pumps the blood, it moves through those vessels and it moves from one part of the body to another. Now, when there is a problem in somebody's blood system, then you will form small components within that channel or within the blood vessel. And those small solid components are what we call blood clots. And we have three major issues that can lead to formation of blood clots. Number one, we call it stasis in medical terms. But in simple terms, stasis means the flow of blood is reduced. The blood stagnates within the blood vessel. Just like I said, the way water gets stagnated within a water channel. So when blood stagnates within the blood vessel, then it is likely to form clots. And there are conditions that predispose the blood to stagnate. And the major condition we know is immobility. Someone not moving for a long time. Blood does not move very fast, and therefore it stagnates and it can easily form clots. That's why we see that these clots can happen in someone who takes a long flight and it takes a lot of time seated, not moving. The other risk factor, like we saw in the late Major General Okech, is when somebody gets injured. So when someone suffers an injury, like a fracture of the bone, you know the blood vessels move near the bone. So that injury to the blood vessel can also cause the blood to clot. And if the blood clots, you form those small solid components, And these ones, if it doesn't go away immediately, then it can cause you more problems. And then the third problem is that there are people who have problems with the nature of their blood. We call it hypercoagulable state. Their blood is more viscous, so it can easily clot because it has some components, or it lacks some components that enable blood not to clot. So those are the three major factors that can lead to clot formation.
Well, doctor, those could be the factors that can lead to blood clotting. But then we can ask, how best can one avoid blood clots? And who are those other people, apart from the ones you've pointed out, those rare cases of people maybe seated in a plane for a very long time? Who are those people who are at that greater risk of getting blood clots and probably ending up dying because of blood clots?
So, as I've said, so when you look at those three major risk factors, so there are categories of people who are more predisposed to those three. For example, people who get stasis are people who stay in bed for a long time. And which people are these? For example, a person who has got a fracture, the legs, the bones of the leg have broken, has got a boda accident, or has got any other accident, they are bedridden, they are not walking, blood is not flowing well. So those people are likely to get a clot. Then we have categories. There are certain diseases also which predispose to getting clots. For example, patients with cancer of any sort, but mostly cancer of the blood. These people also have a problem with the flow of their blood. They also lack some components, so they are also more likely to get blood clots. Then we have the pregnant women. We know that pregnant women also tend to not to walk for long distances. They tend to spend more time lying down or sleeping, and also pregnancy itself can also predispose a mother to getting a blood clot. And then we have people in whom it is a familial problem. It is a familial or genetic, in that they lack some of the components as I mentioned. And these people, they inherently have a problem that would predispose them to getting blood clot. So, but more commonly, the commonest cause that we see is in people who have been bedridden for long, they have had fractures, or they have been operated for other problems and they stay in bed for a long time. These are the people who are likely to get clotting. And therefore we always advise them that people should get out of bed as soon as they can, so as to prevent their blood from clotting.
Dr. Chisule, still on the issue, on the factor of immobility, I assume people who have developed behavior and behavior related to their workplaces or work ethics, who sit in chairs for a long time, people who sit at their workstations for a very long time, is it the same case that they also are at that risk of getting blood clots?
Yes, as I've mentioned, if someone stays in one position for a long time, for most of that day, okay, and we know that being immobile is also predisposes them to even other conditions like obesity, diabetes, and high blood pressure. So it also predisposes them to this condition. And that's why you always encourage people that even if your work involves sitting, you should find time to take breaks and walk. Even if it is an office job, at break time, take a walk. At lunch time, take a walk. If you have to go down the stairs, don't use a lift. You walk down the stairs or climb the stairs. that simple exercise you are doing actually helps your blood to move at a normal rate. But if someone opts to sit the whole day, then going back home, drives the car, then reaches home, it just goes to bed, that person has a higher chance of getting a blood clot compared to someone who does exercise, who walks around, maybe does some bit of jogging, which also actually will help them to cut their weight and also prevent these other conditions. So that kind of lifestyle is not good and can also predispose someone to getting a blood clot in future.
Well, how, doctor, how do I know that I have developed a blood clot, and how fast is it required that someone with a blood clot should seek medical attention? How fatal is a blood clot?
So the blood clot, how do you know that you have it? So the signs, we have what we call signs and symptoms. Symptoms is what you feel. A sign is what we see when we check you. So the symptoms that usually come, is pain. And the commonest site for blood clots is in the legs. The legs and then the thighs, that's where there are vessels which are more likely to have clot formation. So when there is a clot in your leg, you will see the leg swelling. And the leg not only swells but also becomes painful. More especially if it is one leg which is affected. If you see one leg is more swollen than the other one and it is very painful, then that can be a symptom for a blood clot. Though there are other conditions that can present in the same way, but a clot is very likely. More so if you have been predisposed to some of the risk factors that I mentioned earlier. And then the signs we find when we examine is that usually the leg is very tender on touch. When the doctor touches that leg, you feel a lot of pain and you don't want someone to touch it. Even when you walk, you feel pain because of the effect of the clot within the leg. And then the leg can even become hot. The leg is more hot than the opposite leg, which is not affected. So these are the major signs for a blood clot, what we call deep venous thrombosis in the medical terms. And then the worst sign which arises is when somebody all of a sudden develops difficulty in breathing. And that is a danger sign because it shows that the clot has moved from its primary site where it was, most likely in the leg, then it moved through the blood vessel and goes up to the lungs where it cannot move any further. And when it reaches the lungs, it blocks the vessels within the lungs. And that's what we call pulmonary embolism in the medical language. And if somebody gets a pulmonary embolism, it means they are no longer getting enough oxygen within their lungs. So they develop chest pain, they develop difficulty in breathing. And if this clot blocks a big vessel, then someone cannot survive for long when that vessel is blocked, unless they receive urgent medical attention. So that's the reason why we see that among the people, the big names that have got this condition, that they get sudden onset of chest pain, difficulty in breathing, and then all of a sudden life is lost. So that results from the clot moving from one region, that is usually the leg, and it goes and lodges within the lungs, within the vessels in the lungs, and this causes acute onset of difficulty in breathing, chest pain, and if not urgently treated, it results into death.
Doctor, then you can tell us, what is that is there first aid? Is there any procedure one can undertake if he or she detects those symptoms? And again, Can you please tell us what procedure you, the medical practitioners, do to dislodge or probably get the blood clot out of someone's vessels?
So I think the first aid is to reach a hospital as soon as somebody can, because there's nothing you can do there immediately which is going to remove this clot where it is. So that's why the condition is highly fatal, especially if the clot is big, what we call massive pulmonary embolism in the medical language. But if the clot is small, it can give you time, as there is another reserve for oxygenation of the lungs. So when the patient is lucky to reach a hospital, then we first, after examining them, we want to confirm that actually there is a clot. And to confirm that there is a clot, we do what we do a scan in simple terms. It's called, if you are checking the legs, it's called a Doppler ultrasound scan, which is done to check to confirm the presence of a clot within the vessel. And then the one for the lungs, we do what we call a CT angiogram. It is a procedure where you are injected, the patient is injected with a certain drug or a dye, which helps us to visualize their pulmonary vessels, the vessels in the lungs, and we can be able to tell that there is a clot. And once we confirm that, then if it is pulmonary embolism, there are drugs which we can give immediately to help to dislodge that clot. But this has to be done in a major hospital. It cannot be done in lower hospitals. There are drugs which can be injected and they help to break down the clot immediately and therefore restore circulation. But if that drugs are not available, then there are also other medications we use, though for them they act at a slower rate. There are injections which can be given to the patient, which are taken for about 1 week, which actually has also been used in some patients with severe COVID, which help to break down these clots slowly. And then after that, there are also tablets which can be used to help to dissolve this clot. But what people need to know is that this clot takes time to resolve completely. And therefore, when we are treating a person who has a clot, they have to be on medication for at least 3 months. But we usually treat them for 3 to 6 months until when we confirm that the clot has completely dissolved. But there are patients in whom the dissolution takes longer, and there may even be medication for a year or even more, depending on what caused the clot. So the treatment varies, but this is a technical, the treatment modalities are technical. I can't advise someone to do it from home. They need to see a medical practitioner who is competent enough to treat the blood clot.
All right, in just a few statements, tell us what could be the cost of that treatment, and again, is it readily available in this country?
I beg your pardon?
I was asking what could be the minimum cost of such a treatment if one finds out that he has a clot in one of his, and is that treatment readily available in this country?
Yes, so actually treating this condition is quite expensive, because the medications which are used, they are available but expensive. For example, the one which can dissolve the clot quickly, the injection, can go for up to 3 million a dose, and this has to be given in ICU because the patient has to be under close monitoring. So that's why I said that this has to be given in a big hospital which has facilities to monitor the patient. And then the injections which I talked about, which are given on the arm. They also, you may find that an injection costs between 50 to 80 per dose, and someone may need 2 doses a day for a full week, so those are 14 doses. So you can do the mathematics to see how much that dose for 1 week will be. But then it doesn't stop there. There are tablets which someone may have to continue taking every day. And there are different types of tablets. I wouldn't want to mention the names because people may start looking for them and use them unknowingly. Because I said these medicines actually, if not used well, actually they can also cause trouble. Because remember, we are aiming at softening your blood. So they are called blood thinners. So if someone uses them wrongly, again, the blood can be so thinned and they end up bleeding. So when we are using these drugs, we have to monitor the patient almost every week to be sure that the medicine is working within the required dose. So that's why I don't advise anyone to self-medicate on this medication for blood clot, because the medicine is useful, but it can also be detrimental if not used properly. But by and large, the medicine is a bit costly, but the good thing is someone has to take it over a long time, so they may be able to mobilize resources here and there as they use the drugs. But they shouldn't be used without recommendation by a qualified medical doctor.
All right, doctor, I think this may be our last question. If I may ask, it's like you're suggesting that people should do regular exercise, or those who do regular exercise are not prone to these blood clots. And again, does it have anything to do with nutrition? Can nutrition mitigate cases of blood clots?
So nutrition per se may not be a problem or a contributor to clotting, but as I said, there are conditions which result from overnutrition that can lead into blood clotting. For example, conditions of the heart where we get clots in the heart, what we call ischemic heart disease or myocardial infarction. We see that it is more common in people who are fat, who are obese, and we know which foods can lead to obesity. So overeating of such foods can predispose someone to obesity, and then predispose them to heart disease, and eventually end up with a clot in the heart. But then there are those foods which actually can contribute to the factors that prevent blood clotting. We have what we call vitamins, like vitamin K. So vitamin K is found mainly in the greens and the vegetables. But when we are treating somebody for a blood clot, we advise them that they should eat the vitamins in moderation, because again, if they take too much, it can affect the way the drugs work. So by and large, the nutrition, the person needs to have a normal diet, a balanced diet, but avoid eating foods that predispose someone to obesity, which can eventually result into heart disease, and then eventually end up with a blood clot in the heart.
All right, doctor, your last word on physical exercises. Is it very important in this matter of blood clots?
Yes. So as I said earlier, physical exercise will help somebody. It improves the circulation. It improves the movement of the blood within the blood vessels. Because we know that when someone is exercising, their heart is working at a faster rate, so it is pumping blood at a high speed. So blood is moving at a faster rate within the vessels. So this can help to prevent formation of clots. But even if someone has a clot, we actually still encourage them to mobilize, because remaining bedridden or just sitting in one place may make the clot to worsen. So we advise that if someone has got a clot in the leg, but if they are able to walk, we advise that they can walk so long as they are on treatment. What usually makes the clot to move to the chest, to the lungs, to the brain, is if someone has that clot and does not receive treatment, and then maybe continues if he does a lot of movement, yes, the clot can easily move to those dangerous areas.
Doctor,
if somebody is on treatment,
Doctor, our time,
because that helps them to.
Our time has run out, Doctor. Thank you so much, Dr. Ivan Chisule, a physician working with Mulago National Referral Hospital with 7 years experience in internal medicine. We thank you so much for your time, and thanks for that insightful discussion you've given us. My name is Simapolo. Limelight will be back next Friday. You know now what causes blood clots, and you know well how to prevent blood clots. Good evening and a splendid weekend.